Okay, let's get the ball rolling. Good afternoon, everyone. In this talk, we will be talking about what is social sport and how we can make the most of it during the time of COVID-19 with my lovely colleague, Dr. Joe Hudson. Before going over what is social sport, I think this quote summarizes it really nicely. Alone we can do so little, together we can do so much. As in the previous talk, Dr. Ruth also mentioned, we all have a need for connecting to others for psychological but also physiological well-being. As a result, the need for social support come into play. So what is social support? In simplest way, social support refers to help or assistance that we receive from others. And there are three types of social supports, which are informational, practical, and emotional. So what do we mean by them? Informational support refers to people who share with you accurate knowledge. For example, doctor giving you information about your health. Practical support refers to people who can offer physical support for specific tasks, for example, for shopping or childcare. And emotional support is about people who you can talk to about your feelings or people you share common experiences and friendship with. So Joe, I would like to ask you, what are the ways for us to receive social support during COVID-19 phase?
Thank you so much, Aishna. So it can be really helpful for us to think about the social support networks that are available to us when we're experiencing challenging situations in our environment, such as the COVID-19 pandemic. So you'll notice on this current slide, we've written down information across the three areas of social support that Aishna talked about in her previous slide. So you've noticed that we've listed information where we can get accurate information about the COVID-19 pandemic by referencing government resources or the NHS website, for example. However, some of us may feel more comfortable communicating with people much more locally, so you might find it more helpful to list your GP, for example, or your community nurse. In terms of practical support, hopefully the majority of us will feel as though we have access to friends, family, or a neighbour who can support with shopping or getting access to medicines, for example. However, if you feel that this isn't the case, then you can contact Age UK either by their website or by their contact telephone number, and they can signpost you to support that's available within your local region. Lastly, in terms of emotional support, it can be helpful to think about those within your social support network who are particularly good at providing you with emotional support during times of need. But again, some of us may feel as though we don't have those individuals within our network, and therefore you can access the Every Mind Matters website, or indeed you may choose to refer yourself to the local Improving Access to Psychological Therapy service, and you can do this either via their website or contacting them via their telephone number. But of course, when we're faced with a situation such as COVID-19, we have to be flexible in terms of how we're using our social support network. So we need to make sure that we're accessing accurate information so that we can behave in a health protective way, as Joe Chilcot outlined in his talk earlier. But we do know from cognitive behavioural models of anxiety that seeking information too often or too much can actually elevate our feelings of anxiety. So we would encourage you to limit the amount of time you spend seeking information, ensure that you're accessing credible information, and avoid seeking information before bedtime unless you feel that it's an emergency, as indeed this could disrupt your sleep, as Federica talked about earlier in her talk. In terms of practical support, some of us may feel as though we may be getting a little overwhelmed within our home environment. For example, we're only at the moment allowed to access essential practical support. So if you're feeling this way, we'd encourage you to list practical tasks that you feel need to be conducted within your home environment, and perhaps make a note of tasks that you feel you're able to achieve yourself, and set yourself a small manageable task to achieve each day. For example, just for 5 or 10 minutes, and then you can tick it off when you feel that you've achieved this practical task. Lastly, in terms of emotional support, we again need to think a little bit more creatively. So we know from James Pennebaker's research that reflective writing can help us to process some challenging emotions that we may be experiencing within ourselves. Or indeed, it can be helpful to organise video or telephone calls with loved ones to share your emotional experiences. And Aishna is going to give us some top tips on how we can do this on the next slide. But before we get to that slide, we'd be really encouraged to hear how you out there in the public are adapting your social support networks to cope with the COVID-19 situation. And you can feed your responses back by following the link on the poll. So I'll pass you back over to Aishna now for top tips on emotional support.
Thank you, Jo. Our connection to others increases not only through receiving social support, but also providing it to someone. For example, one study shows us elderly people will benefit more if they are providing support to someone, which could be related to increased feeling of independence for them. Therefore, I will provide some tips for us to improve the quality of social support that we are providing, especially in emotional support perspective. Increased distress and uncertainty may change the nature of our conversations to more self-centered topics, such as only talking about our experiences without including the other person. Think about a friend who always talks about their problems without asking you any questions about your daily endeavors. Over the time, you will become less likely to engage with them. Therefore, it is important for us to create a space for both of us to enjoy, which will increase the number of sustainable social support resources that we have over the time. So how we can do that? Asking simple questions like, how do you feel today? And listening to understand, with showing honest care and concern toward what they say without criticizing them would benefit the relationship. This may also help you to see that we all are going through similar problems during COVID-19, and it will make you feel less isolated in your experiences. Also, social support may not always be beneficial for you, especially if it's taking the toll of your personal time. So how we can balance this? Setting clear boundaries on the time that you will be available to others and practicing mindfulness and self-compassion to increase your self-care will benefit you. Which on self-compassion and mindfulness, I will talk more in detail in my another talk. So for now, thank you for listening, and we wish you well during these times.